Game-changing advice on managing worries, avoiding burnout, and tackling OCD. You don't want to miss this episode. Hi, everyone. Welcome to the podcast. I'm so excited to have you here. It is a busy season of life. School just started here. We're in session, and all of the activities make things kind of chaotic. And I am seeing and hearing more and more about burnout and anxiety. In today's episode, I have an expert that you're really going to learn a lot from, Dr. Jenny Yip. She's an expert in OCD and postpartum anxiety, which I know that sounds very specific, but what you're going to learn applies to new moms, but also to everyone else. Dr. Yip shares practical methods for managing our worries, and she emphasizes the importance of self-maintenance over that term that we hear so often, self-care. We talk about intrusive thoughts and the societal pressures that contribute to maternal guilt and burnout. I really want to give you actionable tips to manage your worries, set healthy boundaries, and lead a more balanced life. This episode is a must listen for anyone looking to improve their mental wellness. Thank you, by the way, for being here and for sharing this with someone you think could use it. My mission is to be a light in what can seem like a dark world, and I hope you find that to be the case as you listen each week. Let's get started now with Dr. Jenny Yip. Dr. Yip, thank you for joining me today. This is such an important topic, and often I talk with moms who have a little bit older kids, but this is so important. And I know I have new moms listening or those who have kids and are having more children. Tell me how this became your specialty.
OCD has always ran in my family. I never knew that we had OCD in our family, and I became a specialist in this area because I recognized there was such a lack of awareness and available treatment. So this became my area. And then, of course, when I went through my own postpartum period, I suffered from postpartum OCD unknowingly until a little bit later.
Well, let's define it first of all. What is, we hear a lot in the past of postpartum depression, and that's still often misdiagnosed or not diagnosed. But let's get into the differentiation in what happens postpartum.
Well, in postpartum OCD is not very different than OCD that you experience at any other time during a woman's life. Let me first define what OCD is and what it is not, because I think a lot of people think, oh, OCD, well, I have a little bit of OCD, and you probably don't unless you get stuck with your intrusive thoughts or your magical compulsive behaviors. So if you just like your things clean and aligned and you like everything color coordinated, that's not really OCD. It's OCD when you keep getting these intrusive thoughts as if something terrible will happen unless you have this thing fixed. So a lot of people get intrusive thoughts about potential harm to their loved ones, safety issues, or even just horrific images that come into your mind. And it's important to recognize that when you get these intrusive thoughts, you don't really like them, number one, and they don't really sit well with you. It doesn't fit your values or your belief system. And because we feel a lot of distress or guilt or shame from the intrusive thoughts, we want to get rid of them. That's where the compulsions come in. The compulsions are basically anything that you do to feel better, to get relief. And the reason why OCD is so vicious is because every time you engage in a compulsion, you get that relief, you're more inclined to do that behavior again and again and again to get that same relief. Because the truth is, we all get intrusive thoughts. That's the truth. However, those of us without OCD will have an intrusive thought and go, oh, okay, that's no big deal. Whereas those of us with OCD will have an intrusive thought and go, oh my goodness, what was that? Why did I have such a horrific thought of harming this child or molesting this girl, we don't sit well with those ideas or the images, and therefore we question the thoughts themselves and why we are so monstrous to have them. However, that's the kind of the culprit to the problem. As soon as you question and you magnify it to more than what it is, then you're giving the thoughts power. And then when you give the thoughts power, they create a lot of distress, anxiety, shame, and then you want to do something about it. Then you engage in the compulsions, and that's when the vicious cycle occurs. So that's OCD in general for anyone, and a lot of patients will get stuck in their thoughts and can't keep moving. So it really interferes with the person's functioning, which is why if just because you like your things color coordinated or clean and tidy doesn't mean you have OCD, unless it interferes with your functioning. Now, a mother suffering from, and let me just say, it's not just mothers, fathers too. We can talk a little bit about that later. Though, a new parent suffering from OCD, the content of the thoughts will usually focus on the newborn or the health of the mother. So thoughts usually surround about potential injury or accidental harm to the baby, whether it's choking, drowning, SIDS. These are very common fears that most parents will have, except for a mother or father with postpartum OCD or even perinatal OCD. The thoughts are occurring at a much more intense level. And then the urge to do something about it, to prevent it, is much more excessive. So the only difference between postpartum OCD and anyone else experiencing OCD is that the focus of the intrusive thoughts surround the baby or the mother's health.
In such a volatile time for a family.
Yes.
Okay, so a lot to unpack with everything you just said. Let's talk about the how common OCD is, or how not common it is in the regular population, men and women, and then postpartum.
Sure. So, the truth is that because there is such a lack of awareness and accurate diagnosis, that the numbers probably, I'm not even going to say probably, I'm going to say likely, is underrepresented. So if you look at the research, and there hasn't been much research done on prevalence rates recently, especially since COVID, the old research from decades ago will point out about 1 to 2%, 2 to 3%, no more than that in the general population. There isn't a difference in terms of between male or females. But we do know that whenever there is a hormonal shift, that tends to be a risk factor. So a lot of teenagers going through puberty, that is a prime time if you are predisposed with the genetics for OCD, for that to be a vulnerable period. So obviously, during the perinatal postpartum period, that is also a vulnerable period for many new mothers. However, that doesn't necessarily explain why fathers have postpartum OCD, right? That only explains the hormonal shift that does occur. Now, with the postpartum period, the research is also even more limited, because so much more attention is being paid on postpartum depression. Even when you go to prenatal and postnatal care, questions might be asked about postpartum depression or perinatal depression. However, not very many OBs or pediatricians are savvy enough or knowledgeable enough to inquire about postpartum perinatal anxiety or OCD. So a lot of these women go undiagnosed or misdiagnosed. However, the limited research that does exist, point to anywhere between 10 to 50%.
Wow.
And, obviously that is such a huge range, 10 to 50%, that we know we need to do more research around this topic.
Absolutely. How often does OCD go along with depression and anxiety, or does it stem out of the depression and anxiety? Which comes first?
Usually, when I do see mothers suffering from postpartum or perinatal OCD or anxiety, depression is oftentimes secondary. Obviously, if you're having trouble bonding with your baby, if you're not enjoying your pregnancy or your postpartum period, I mean, not very many mothers actually enjoy the process of the postpartum period. However, most mothers will say they enjoy being with baby. However, a lot of mothers who aren't enjoying this, it's not necessarily because it's just depression. If you're having intrusive thoughts about potentially harm befalling your helpless newborn, you might feel like the whole responsibility is on your shoulders. And therefore, you might fear being alone with baby, because what if something terrible happens?
Right.
You might fear being the only one responsible for feeding baby, bathing baby, putting baby to sleep, because what if something happens on your watch? You might fear changing baby's diapers, because what if you look at the genitalia twice and think, oh my gosh, why would I look at that twice and think I must be a pedophile? So because of the horrific nature of these intrusive thoughts, you might fear being alone with baby. And then you might start questioning, what's wrong with me? Why am I doing this? Why don't I want to be with baby? Why can't I connect with baby? Why can't I bond? Why am I not enjoying this? And of course, if you're having all of these, unfamiliar or uncomfortable thoughts as a new mother, why wouldn't you feel depressed?
Right. Yeah. And guilty, or like you said, the shame, and then all of that compounds. Okay, let's get to some solutions. We've identified the problem, which of course is the first way. I mean, that has to be a huge weight off of someone's shoulders to say, it's not just me. This happens. This is hormones.
Yes.
This is not me being a bad person. But let's talk about some solutions. And if you could, I think I might have some people who are identifying with this past postpartum era. Like maybe they have teenagers and they're saying, that's how I was, and I still feel guilty about it. So if you could broaden it to anyone who's dealing with OCD, the anxiety, and then we can get a little bit deeper into new mamas. But let's just talk a little broader so that we can give people help.
Right. So I'm going to focus more specifically on mothers. Because this is, actually, I talk about this in my new book, Hello Baby, Goodbye Intrusive Thoughts. It's actually the first book of its kind written about the perinatal postpartum journey of mothers experiencing intrusive thoughts, anxiety, and OCD. And what I specify in my book is that we as mothers try to do too much. We put the world's weight on our shoulders. We try to be everywhere and be everything to everyone. And that is a lot of responsibility for one person. And unfortunately, families today aren't like families in the past, where we get to sit down together for dinner, we wake up, and, it might be a little bit of chaos. However, families in the past, 20, 30 years ago, weren't as busy and chaotic as we are today. And as a mother, and I'm going to say I am a working mom, though I don't know what mom isn't working, having all that additional stress and pressure and societal expectations on our shoulders will naturally breed a sense of guilt, a sense of shame when we feel like we're not meeting societal expectations. And in my book, I also point out the mental load, the invisible mental load that we have on our shoulders, that by growing up the way that girls and boys are brought up differently, we naturally take on all of those invisible worries and invisible responsibilities that nobody else knows what to do with. So of course, if you're going to, as a mother, carry all of that weight, something off, right?
Yeah.
Nothing is ever perfect. And therefore, when something doesn't go the way that you had anticipated or that you have wanted it, then how would you feel, Natalie?
Yeah, that's right.
Terrible, right?
It's so common. And I just spoke about this last week on the podcast of that mental load and that expectation society puts on us as women, but we also put on ourselves.
Absolutely.
And I think maybe it's the generation where at least I grew up feeling like I can do it all. Oh, I'm so excited. I remember my first job and my first baby thinking, I get to do everything. This is awesome, until I reached burnout. Right?
Yes,
and now we're
absolutely.
seeing that generation reaching that point of burnout, thinking, well, why can't I do it all? Society told me I could have this awesome career and raise babies and have a beautiful home and keep it clean and keep it organized and make dinner.
Right.
And we can't. And I almost feel, and maybe you do as well, that in some ways society isn't helping us like it used to. Grandma used to do more. The neighbor used to do more. That we chipped in to each other's lives a little bit more. But now it's like, she's the strong woman. She can do it.
Right. So the expectations have shifted, and I blame a lot of social media. I mean, social media has contributed to this, we can do it all. We're super moms, right? And I remember even like 10 years ago, we would call each other, oh, you're a super mom. And now today, when my colleagues or my girlfriends call me super mom, I said, my response is, no, I'm not really super mom, and I don't want to be super mom, because
so
why
funny
would
you
I
say
want that
I
title?
actually have this
that
picture.
Is such a burden.
You'll laugh at this, and now I look back at it and I think, what was I thinking? What was my family thinking? I have this picture that was on my desk in the newsroom as I was a TV anchor for many years. And after my first baby, someone gave me a picture of Wonder Woman with my head on it, like with their hand up, saying, you are Wonder Woman. Right. Wow, Mom. And I was like, oh, thank you so much. That just feels so good. Yes. And now I'm with you. I look back at that. Yes. And I gave myself this badge, and all it did was contribute to the burnout.
Yes, absolutely.
And pretending that I could be that.
Right. And unfortunately, with burnout, it is so much harder to pick yourself up once you've gotten to burnout.
Yeah.
And if you don't have the mental bandwidth, the fuel for yourself, what good are you for your family? And I know for myself, when I reach burnout, I am no fun to be around. And my kids will be the first to tell me. Yes. My kids will be the first to tell me, Mommy, I need you to smell the bologna. I need you to breathe the bologna. I need to be the bologna and just calm down. That's what my kids will say to me now. But, like OCD and our intrusive thoughts breed on guilt.
Mm-hmm.
So, and the thing about OCD is that it tackles whatever it is that you care about. So if you care about motherhood and you care so much about being the perfect mom, well, guess what? That's where your intrusive thoughts will tackle.
Yeah.
And in my book, I even talk about breaking your perfect household disease, because we all have this. We all have our perfect household disease, which unfortunately we were raised to take on. Because if you look at the statistics and the research about the difference in how we raise girls and how we raise boys, do you know that girls and boys, even if they are the same age in the same family, tend to be rewarded more with less allowance for doing the same amount of work? girls are expected to do more. When girls are not doing the chores or taking on the responsibilities given by their family, they tend to be criticized more. Whereas boys are often more overlooked if they are not completing the same amount of chores or the same amount of responsibilities. So by nature, girls have been brought up to believe that my value is tied into how well I'm taking care of other people, how well I'm taking care of household responsibilities. So ever since we were little, we've been raised to believe that in order for me as a girl, as a woman, to be appreciated, to be valued, the house has to be perfect.
Yeah,
People
my
have
room
to be
has to
taken
be
care of.
in perfect order, and I have
Exactly.
to cook a nice meal. And
Exactly.
so let's talk more solutions. I want anyone listening who relates to this or who's worried about that in themselves or someone in their family. What would you suggest? What do they do?
Well, I think it's first most important that you have to build a flexible mindset, which is realizing that insanity is doing the same things again and again and again, expecting a different result. So if you're feeling burnt out, if you're feeling anxious all the time, if you're ruminating all the time, then it's time to do something different. And maybe the methods that you've been using hasn't been the most beneficial or the most healthy. So if you tend to be a worrier, helping you to build a flexible mindset might mean sitting down, and I call this the 15-minute worry time, which is for 15 minutes. You're going to sit down and you're going to write about your worries. Because what happens when we tend to worry, it's like a runaway train.
Yeah.
It's just spiraling out of control. So instead of letting your worries spiral out of control, it would be much more helpful for you to not just sit and externalize your worries, however, spelling them out in a short, concise, direct sentence. I'm worried about my children. I'm worried they are not getting the nutrition they need. I'm worried they are watching too much TV. I'm worried that they're not making friends at school. These worries have a specific beginning and an end. It's not a runaway train. So you sit down for 15 minutes, and for those 15 minutes, you have to write out the entire 15 minutes, even if you run out of your worries. And most moms will say, well, I actually run out of worries before the 15 minutes is up. Still, you have to keep writing it. And what a lot of moms will tell you is that once they're able to get the worries out of their head and onto paper and then look at it, okay, I'm done with it now. And having that on paper will help you to start making solutions and recognizing what is it that's causing you anxiety, that's causing you to burn out, and perhaps looking at other ways to attend to your worries instead of just leaving it in your head and ruminating over it first thing you wake up and last thing before you go to bed.
Yeah.
And we all have to establish healthier boundaries. But here's the thing. Healthier boundaries doesn't just mean boundaries with other people. It also means boundaries with myself. So what are mental, emotional boundaries that you need to establish with yourself? If your teenage daughter calls you, some terrible name, Mom, you're an asshole. Okay, you can either take that to heart, or you can establish emotional boundaries and recognize, okay, well, she's a teenager, she's going to go through hormones, this is her, and maybe I will have a talk with her about this at a more opportune time, not right now, right? These are boundaries that we need because the emotional and mental boundaries keep us from going into burnout. So along with the boundaries, what I also specify in my book is that we've now gotten to this space of self-care. And while self-care is valued, though the term the phrase is a terrible term because self-care makes it sound like it's optional. I can either care or not care, but the truth is it's not optional. So the term that I coined is self-maintenance. Think of your car. You have to maintain your car. You have to take your vehicle in for maintenance, for checkup. You have to give it gas or plug it in to get the fuel that it needs. Well, how are we different? Because if we run out of fuel, not only are we not good for ourselves, we're not good for anyone else, and we won't have the bandwidth to connect in a more loving, authentic way with our family members. And because we do have all of the load on our shoulders, our families do rely on us. So I would say embrace self-maintenance versus self-care. And then with your perfect household, thank you. And with your perfect household disease, does it really need to be perfect? And when you do share your load with your partner, your family members, and if they don't do it exactly the way that you want it done, is it really that terrible? Or can you turn a blind eye? What are the implicit messages that you're giving to your family? It's really important to be conscientious of what are those messages that you're sending your family members. Are they messages to encourage them to keep helping me and to keep sharing the load to get it off my shoulders? Or are they messages such as, you're not doing it right? Or are you giving side-eye glances that indicate you're dissatisfied with how your family members are doing their part, doing their share, right? So these are the implicit messages that you have to be conscientious of. And there are many more tools than what we have time for today. However, I have it on my book, and I think specifically with OCD and intrusive thoughts, just know that when you avoid anything that you avoid, you're actually giving the thoughts more power. So it's no different than if I ask you, don't think of the yellow duck. Don't think of the yellow duck.
You're only going to think of that.
You're only going to think of it, right? However, if I say, Natalie, I want you to only think of the yellow duck. Just think of the yellow duck and nothing else. Yellow duck, yellow duck, yellow duck, yellow duck, yellow duck. After a while, that yellow duck gets boring. And your mind wants to go somewhere else. So with intrusive thoughts, it's the same thing. If I tell myself, don't think of this horrific thought, guess what? It's only going to be louder. If I avoid baby, then I never get the corrective feedback that, oh, it's actually not so terrible. I actually can do this. And even though I have the intrusive thoughts, I can handle it. And so avoidance is the worst thing that you want to practice. You want to practice exposing yourself to doing the things that will actually connect you with baby.
When does it get to the level of getting help? All of these things, of course, are help. But when is it a level of, I need a doctor, I need medicine?
Yes, I think anytime that you feel like you can't handle it, that you are not functioning well, it's time to find someone who has experience in treating postpartum OCD or postpartum anxiety. And it's important to find a specialist who actually knows how to treat OCD, because the evidence-based treatment for OCD is exposure and response prevention therapy. It's not drinking, green juice, as I've seen some ads for. And literally, there's like a celery juice a few years ago that someone was selling as a cure for OCD. I mean, I think that the thing is, when you're so deep in these like intense, hurtful feelings and you're helpless and you feel hopeless, it's desperation that people, unfortunately, unethically, will prey on. But it's so important for you to realize that there is help, and treatment is very short term. It's very effective. And there is the International OCD Foundation, as well as the Anxiety and Depression Association for America. So it's iocdf.org and adaa.org that has a directory of therapists who have specialty and experience treating OCD and anxiety. So it's important to discover that information. And along with my book, I will be hosting webinar classes, master classes for mothers specifically to help them navigate this journey to really be able to implement the tools that you'll find in my book.
Wonderful. Well, thank you for your expertise, for your advice, and I'm happy to be a part of alerting people and giving them tools. It's my goal in the podcast and helping people. So thanks for what you do and for sharing it with us today.
Well, thank you for what you do, Natalie. I'm so glad that this, space is available for mothers, and I hope this has been helpful.
Most certainly has.